Hey, what's up, everybody? My name is Kingsley. I am the owner of Evolve to Perform.
And I am Jordan. I am the client coordinator / administrative assistant / social media person / anything else that needs to be done at Evolve to Perform.
Exactly. So she's basically our chaos coordinator, really keeps us organized. So we want to welcome you to the pilot episode of our podcast. Now, the idea of our podcast is to just bring together all of like the really amazing people in the health and fitness space on Long Island, especially in Nassau County. And we're hoping that as we continue through our episodes, that we're able to bring to you high value, being able to talk to you about all types of topics in regards to health. So that's going to be physical health, because that's what our strength is, but that also does tie in mental health and all the other aspects that you need to be able one whole healthy body. So we're really excited for that, because we're going to really start to dive into some various topics. We're also going to kind of touch some new things and new concepts that you may not have heard about, just to introduce it to you. And then most importantly, we're really going to work on curating a bunch of really high-powered, knowledgeable guests and experts in their field to really teach you some new things just about health and wellness. So we're really excited.
Right. And the whole idea and the reason why we had thought to start a podcast is because we're on Long Island and we have so many great connections both on Long Island and everywhere. So this is truly going to be just the one-stop shop for you for all your information for nutrition, fitness, PT. We'll get into everything.
So yeah, we're really excited and just welcome, and we hope you enjoy the ride.
There's more to come. Stay tuned.
All right, so for this episode, we're going to be talking about frozen shoulder. That's going to be our main topic. So, all right, let's go at it.
All right, so I know nothing about frozen shoulder. What is frozen shoulder?
So frozen shoulder is just like a widespread diagnosis of like, hey, all of a sudden, I can't move my shoulder. I really don't have the full range of motion to be able to do all of like the basic things that I would every single day. Like simple things like for women, like being able to like reach behind your back to put on the bra, okay? Unclasp bra, clasp bra. That's one of the main things that really pops up there, that direction. So it's just like kind of like, it seems like it can just pop out of nowhere. So like the causes are all like, not random, but like sometimes we had a hard time really pinpointing like what caused it. What we think is most of it is like if you irritated your shoulder, and like like it's like if something bothers you, like you really baby it, and you start like and you stop like reaching for things and pouring whatever it is, like you stop using it. Just like that protection itself, like you're just guarding, can lead to like a frozen shoulder.
Really?
Yeah.
Okay, so does there have to be an initial injury first and then it turns into frozen shoulder, or can you just get a frozen shoulder?
Well, yeah, so not necessarily like where there needs to be like an initial injury, like so if you're, lifting a weight and then you just feel something and you just like stop doing it, or if you're just doing something with everyday life. It also, there's women also, especially like at a certain age range, there's like a higher prevalence for this just to kind of like almost like spontaneously like kind of appear, right? So it could be a couple of reasons.
But wait, what's the age range?
Well, I mean, we're talking about like women like within like the perimenopause, menopausal age.
Okay.
So depending on that, right, it ranges now. Because like in some countries and some places, they actually call it 50-year-old shoulder.
That's crazy.
Yeah, because like, what we're finding out is that it's like there's hormonal response that leads to these things. So if it's like some, for a woman who starts to have a decrease in estrogen levels, then the body starts to like not be able to fight off inflammation as well. So then all of a sudden, could be based off of other lifestyle factors, like I'm not as active. It's been a minute since I raised my arm up over my head. Like treating your shoulder like a shoulder, then all of a sudden it can just, you can develop something like this.
But men can get it too.
Yeah, men can get it too.
Sorry,
there are some like other like metabolic conditions, like which are, like diabetes. Like if you have diabetes or you deal with like that type of stuff, metabolic condition, then there's going to be an increased chance, to develop like a frozen shoulder.
Okay.
the problem with frozen shoulder is obviously like you start to lose function of the arm, but it's also very painful. It can become very painful because like, you know, some of the, I mean, like what's recommended when someone comes to physical therapy is like we have to like aggressively stretch it.
That doesn't sound fun.
It's not fun. I mean, you know, you're talking about, like if you want to picture this, right? Like within the shoulder is like a ball and socket joint. So we know this, right, from anatomy, basic anatomy. But
hopefully,
we do.
maybe some people don't.
Right, we do. So so with the shoulder's a ball and socket joint, and on top of that, like there's coverings of like soft tissue around it. So like it forms like a layer. You know, there's layers of soft tissue which we call like ligament or capsule.
Okay.
And so like if you were to picture like, you know, all right, so like if you have like a wool sweater, right, and you throw that sweater like in the dryer, what happens to it?
It shrinks.
It shrinks.
Okay.
So like the capsule that sits around like the ball, you know, the ball and socket joint of the shoulder, it's kind of like that, right? It's like taking like a wool sweater, and then all of a sudden you threw that in a dryer, so that capsule around your shoulder just really constricts.
Ooh, that's really good imagery that I don't like.
Right. Yeah. So, you know, and so like when you picture that, then it's really clear and apparent that like I can't move my arm because like that capsule can't accommodate any movement of the spinning and the turning of the ball and socket joint.
Oh gosh.
So
okay.
yeah.
Okay. So why do you have to aggressively stretch it when they come in here?
Well, because then it's like, because it's going to go back to function. Like, are you able to just move your arm and do the things that you need to? Like, so the typical things of like putting your arm in a shirt or a jacket, or grabbing my seatbelt, or, you know, just lifting my head, you know, my arm up to put something on a shelf, you know? And then of course, from a fitness aspect, like you want to be able to make sure that you're not just like limited to doing like lower body stuff, and you still want to work your arms and you want to do all that stuff. Right. You know, the old principle, like if you don't stress something, if you don't use it, you're gonna lose it. Right. And we want to make sure that we're maintaining like the elasticity of the capsule of their shoulder, so that we can then like allow ourselves to use the muscles that we need to move the shoulder. So it's like kind of like it's just not a productive cycle, right? Because you go from I can't move it as far, my muscles don't want to do anything, then I can't move it as far, then my muscles don't even want to do anything else. So it's like they start to forget how to work. Right? You'll build up imbalances of just like, you'll build up imbalances of where you're strong and where you're not strong. Because if you don't expose your muscles to all different ranges of motion, then it's not going to know how to move something and get it back to where it's supposed to go.
Okay, got it. And can the frozen shoulder get more frozen as time goes on? Like it can get progressively worse? Or it's kind of like frozen, that's where it stays?
Here's the interesting thing is that, yeah, it can get worse, but at the same time, it also can get better over time.
Without doing anything?
Right.
Okay.
So it depends on who you ask, because like they have like certain like phases of the shoulder, like they'll have like a thawing phase, you know, which...
Stop! Yeah. That's funny. Okay, so if it gets worse, do they call it frostburn?
No.
Oh, damn.
No, there's not. I mean, hashtag frostburn, right? No, but
PT community, what are you doing here?
That's right. No, there's no.
But thawing, that's hysterical.
Yeah.
Points for that.
Right. So I mean, to kind of go off that theme, right, of frozen shoulder. But yeah, there's like a thawing phase that just happens over a period of time. But like sometimes that could be anywhere from 1 to 2 years after you develop a frozen shoulder. So I don't know about you, but I want to get use of my arm a lot sooner than that, right?
No, of course.
Yeah. So we want to regain that function, and of course, like we want to make sure that you get the muscles back online as soon as possible. That's like really, really important. So that's why, So that's why we need to get to some aggressive motion, and we have to be really careful because if we get too aggressive, then we can just like repeat that cycle of too much inflammation. That's painful.
Frostburn.
Yeah.
So are there any injuries that if you injure this particular muscle, or if you tear this particular muscle, or you hurt this ligament, I don't know, like you're like, oh, be careful because that's going to lead to frozen shoulder?
You know what? That's a good question. No, I don't think so, and I could be wrong, and I'm sure like if someone wants to correct me, they can. I'm happy to learn more about that.
Leave it in the comments.
Right, but I think I think there's so many muscles that help you move the shoulder and things anyway. So like the second you start to just really like guard and protect yourself, then there's going to be a higher chance. But it really is. It's like that age range is what we look at. Some of those other like health factors as well. It's just going to be more of a reason to say like, hey, you can't let this sit for too long. Like just like anything else, it's okay to take a little bit of a rest, let things calm down. But if you are within that category, you really want to try to stay on top of that as soon as possible.
Got it. So no particular injury. It's just if you feel like you have something and you're babying the shoulder, you're at risk to develop a frozen shoulder if you're within that age range and everything like that.
Yeah, absolutely.
Cool. So do you it feels painful, frozen shoulder?
Oh yeah.
Very painful.
Yes, very painful, unfortunately. I mean, like, let's put it this way. I've heard that it's worse than pregnancy, right? Delivery and things like that.
Delivering a child, it's worse than that?
Yeah, I mean, I've been told by some of the patients and clients that I've worked with that it's worse than that. So
the men. Just kidding.
Right. Yeah, the guys who are just sitting there, like, kind of behind the curtain or
They're like,
or not
it was
involved.
worse than watching my wife give birth.
Right. Yeah.
Okay, that's crazy. Is there a specific part of the shoulder where you'll feel the pain first, like the front, the back, the side, or it really depends on you as a person?
Yeah, good question. I mean, just like from like my my experience like with working with like people with that is like it's really like actually like the side of the shoulder here. So it's kind of like it's like the side of the shoulder, and it's like it can be like a dull pain sometimes, like like it's almost like a toothache. It's very common and very similar to like pain with like what we call like a shoulder impingement. So there's like certain like levels where you raise the arm, certain positions where you feel like it's just like this like pain on the side of the shoulder. But that's where I've been told like most of that pain is.
And if someone suspects that they have a frozen shoulder or they start to feel that pain, how soon should they get into physical therapy?
I mean, I think they should get in as soon as possible.
Okay.
Of course, if like they don't have any other like comorbidities or any other factors that they have involved here, but I think they need to get in as soon as possible.
Okay, and just again to make sure that they get out of pain, or because the longer you wait, the worse it gets, or like what's your rationale behind that?
Well, because I want to make sure that we're educating someone on what kind of like stretches and things that they need to do, what kind of positions and shapes they need to get the arm into, just to make sure that so that capsule doesn't stiffen anymore. And then the trade-off there too is hopefully with more of that release of the capsule and things like that, then there's going to be less pain. So, we want to really, we're huge on like patient education, teaching someone how to do stuff, and making sure that you like are able to take care of yourself, because we don't want you to depend on us for everything. Like you guys are so capable of doing good stuff for yourself.
Right.
So you have to get that going really early.
Right, which perfectly leads me into my next question. So, frozen shoulder, you see your PT. How many days a week would you expect to be at PT? Multiple days or just one day a week for a couple of weeks? Like, what's the recovery process for that like?
That depends on you. Yeah, right? Yeah, exactly. So
I decide for everyone.
Right, so call Jordan and she'll tell you how often to come for frozen shoulder. No, it really depends on the individual, because, you know it, like there are some people who will follow everything that you say to a T, right? And they're like, I want to get this done. But if you're the type of person, so if that's the situation, maybe they come in early on, like maybe once a week, once every 2 weeks, as long as you're doing your homework, because all that other stuff that you do outside of here for that 1 hour that you see us is the most important thing. Then, of course, there's some of you who just need like that extra push, that little bit of pressure, accountability. So you may have to come a little more frequently, for that. Most of the times, traditional, medicine will say you've got to come in like 2 to 3 times a week, but we know that's not sustainable with the way that we're set up. But we feel that even if you come in once a week or once every 2 weeks, as long as you do your homework, you're going to make more improvements than you would going somewhere else, because you know what you need to do. Whereas like you may not get like the best advice or more as aggressive type of work, or kind of different set of eyeballs and approach to it. I think like that we have.
So when you say homework at home, do you give people more stretches or more strengthening for this, or is it a combination of both?
Yeah, it's going to be a combination. Early on, it's like, let's get more range of motion here. Let's just, get you more access to those spaces. But we always, as we continue, we always want to make sure that, as you start to make more progress, you get more access to ranges of motion. You also know how to get those muscles to turn back on. So there is going to be some progression. It's not going to be the same exercises all the time. Mm-hmm. And it's also not an if-then type of thing, meaning if we get this type of rotation here or movement to get the arm that far back, then we'll start doing exercise to strengthen. It's always going to be working together. So it's like, hey, okay, you may not have full yet, but let's make sure that we know how to get the muscles to turn on and get you back to that position that we're at. Mm-hmm. So the exercises and the progressions should be changing, and it's going to be dependent on each person. Mm-hmm. Because every frozen shoulder diagnosis that we get here presents differently. Some of you might have a harder time reaching behind your back, right? That's the most common restriction. But some of you might have a harder time bringing the arm up fully overhead or out to the side. So we have to kind of tailor it to you. What's going to work best for you.
Okay, and I want to take it back to something that you said just now about that it's not an if-then. Is that your school of thought, or is that a thing in the PT world? Does everyone feel that way, or are there some PTs that are no, we're just gonna stretch until you get your full range of motion back, and then we're gonna strengthen?
Yeah, I think that depends.
It depends.
I think it depends. It's the same person who says I'm going to before I go to a CrossFit, I'm gonna get in shape.
I knew you were gonna say that.
She's probably heard me say it a bunch, but it's that's the thing. It's well, that doesn't make sense, right? Or I think there's a better thought process there, because it's how are you going to, you're going to get into shape if you start something like CrossFit, or you start another thing. Mm-hmm. It's not saying I have to get into shape before I want to do the thing, right? So it's not not to say, look, we can't do anything else until you're able to stretch this far. Mm-hmm. So yeah.
Okay. And then if you have frozen shoulder once, are you likely to get it again, or not necessarily?
That's a good question. The only thing I can say is that the greatest, and this is what a lot of PTs will say, or a lot of people in our space will say, it's the greatest predictor of an injury is a previous injury. So yeah, if something has happened before, and you did the work, and you're I'm good, and then you just go back to old habits, then who knows, right? Our goal is to get you to past a certain point so that you can get back to the thing, not to not doing a thing, right? So, and hopefully by the time you're done, you'll start to see the benefits of movement, of exercise, strengthening, whatever it is, and then continue on with that after, and then who knows what else you want to do.
Right.
You want to learn something new, you want to try something different, at least that way, hopefully you'll leave with more confidence to do something.
Mm-hmm. Okay. What would you say to the phrase that being active would help you be less likely to get injured? Do you think that's true?
100%.
Okay.
Oh yeah.
Some people, I think they feel because they're so active, they're just asking for an injury. But I think it's the complete opposite, right? If you're more active, you're less likely to sustain an injury. Yeah,
for sure. It's going to make you more resilient, right? And then also it's that you have this, it's like carrying an extra insurance policy, right? Or carrying an extra battery for your iPhone when you go to Disney and then the battery drains and you got to charge it up. Mm-hmm. You know that you've got something in the tank outside of your normal stuff that's going to be able to carry you and hold you. Mm-hmm. And I've also heard too, would you rather deal with an ache and pain from being active, okay, or would you rather deal with the health problems that come from not taking care of yourself?
True.
All right, so it's hey, what's my trade-off here? Okay, I've got an achy shoulder because I lifted a barbell over my head, whereas it's I'm at a higher risk for heart disease because I don't do anything.
Right.
Or I'm going to start to lose sensation on my feet because my blood sugar is so high and I'm a diabetic, and and now I've got to worry about these other things. So like it's like you have to decide like what the trade-off is, what you're willing to suffer from, because I think like a temporary injury from moving and pushing yourself a little bit is a lot better to deal with than something that's going to last longer term, right? And just affect you for the long run.
Right. I agree.
Well, I want the audience to understand too that with frozen shoulder, PT is not the only option.
What?
Yeah. I mean, of course, you're going to hear surgery.
Oh, okay. I was like, what else could they do?
Sure. So surgery, is obviously one of those things that you're going to hear. And like a lot of the times, like a surgery for that is what's called like a manipulation under anesthesia.
Oh, okay. That doesn't sound fun.
And it's coined as surgery, but it's like most of the time it's just putting a patient out under anesthesia, and then they'll just stretch you like we would, but it's just that there's no you're not up to fight it. Okay.
Oh God.
So
and you
it's
gotta
like
pay a lot of money for that, I'm sure.
Well, I'm sure, right? I mean, there's definitely the other expenses and costs here, but here's the thing. Just because you do that and your surgeon's able to stretch you in all the directions and like basically like just open up all of the soft tissue restriction and stretch out that capsule, guess what you have to do right after that?
Go to PT and do the same thing.
That's right. So the question is like, what do you want to do, right? Do you want to have someone, and you'll feel like you get hit by a bus. So do you want to like, do you want to have it done differently? Like, do you want to go ahead and be like, hey, I had surgery, that should fix me. No, you still have to come to PT anyway. Yeah. Because like, most likely, right, this happened because you had higher risk factors for just getting stiff really easy.
Right. Right.
So you can pick and choose, but yeah.
Yeah. And we're very anti-surgery here. Not in like you need the surgery, don't get it. We're in the surgery should be your absolute last option. Like we don't like surgery is our first choice. No.
Yeah, I mean, because look, I mean, just in this case in general, right? Like, you can rehab a frozen shoulder without the surgery, and so like we just want you guys to understand that your bodies are so capable of healing if you just put them in the right situation and have the right conditions around it.
Right. So that surgery that you were just mentioning for the frozen shoulder, they don't even like cut your body open?
No, I mean, like it's I mean, there's like. Yeah, I mean, like unless they feel like there's I hate to use this word, like scar tissue, a lot of scar tissue in there, but most of the times it's just like, hey, let's just stretch you.
Under anesthesia.
That's right.
So that's why it's a surgery.
Yeah.
Quote unquote. Okay.
That's right.
Wow. Okay. Learned something new well, I learned a lot of new things today.
Good.
Okay. Anything else that we have to discuss about frozen shoulder?
No. I mean, look, if there's anything else that, the audience wants to share, you guys want to give me some new information that I might be outdated, I'm willing to, learn from you and discuss it. So.
Yeah, we love learning here. And if there's any other topics about shoulder injuries, shoulders at all, leave a comment below. We can try to get to it. And that's our episode for today.
Thanks, guys.
Everyone have a wonderful day. Evolve to perform to evolve. Like this video, comment, and we'll see you next time.